Greetings of the day, Professor. This is Amanjot Kaur from Nursing Informatics Group KFF. My student ID is 186083218. Here, I would like to present a video on the topic reflection video. In this video, I will discuss the purposes of each week learning and how these purposes are beneficial for the upcoming nursing leaders. Well, what is nursing informatics? What is the significance of technology in it? Well, nursing informatics is a new and established specialty into the field of nursing, which allows the nursing leaders to provide the best competent care to their patients. Coming to the weekly learnings, in the week 2, the learning objectives were the definition of nursing informatics, health informatics, guiding principles as a fundamental skill for nursing informatics required in it. As per according to me, I believe I have gone through them and I completely learn it. Not only just I read them, but also perform certain activities in it, which is the quizzes, the test, which involve into my learnings. And also I have accessed the EHR app, which proved to be a good resource into my weekly learnings. For an instance, in the beginning, there was the definition of nursing informatics, which I could not get it properly as this was a complete new term for me. But when I accessed the EHR app, not only I have just accessed, but also I have performed the assigned activities in it, and it just becomes so easy for me to access it and to learn about nursing informatics. For example, there are many options available, likely there are vital tabs, alert tabs, meds, care plans, and so on. While accessing it, I came to know many things about it. For example, when there is a patient who has a fall risk, then this will appear as a red colored cautious button at the top of the chart of the patient, which will indicate the nurse that this is an critical situation which need to be handled properly. So ultimately, the nursing informatics definition indicates that it is an integration of nursing science and informatic technology into the field of nursing and to manage the data of the patient. Furthermore, there are many options available also, and the data of the patient can also be accessed by the other health professionals also. Here, I would like to share a personal experience of mine also. When I was working as a student nurse in India, there were facilities present, but they were not really advanced as of nursing informatics. So, as a student nurse, I did perform the vital signs of the patients by manually, and I fill the chart of the patient by hand with the pen. While doing the graphical representation of the vital signs, I used to take different colors of pen like red, blue, black to mention the respiration, the temperature, and blood pressure also. So while doing it, it was really hectic sometimes, because in nursing you have not that much time to spend on by using different pens. So there was a feature in the EHR app which I really found interesting, and which was that there is a colorful graphical representation of the vital signs. So personally, I believe that nursing informatics will provide the nurse leaders the error-free care to them, because as all the information entered into the computer would be reliable, and so ultimately it will leads to an error-free record of patients, as all the data is more reliable, and there the chances of mistakes would be negligible. Moreover, it also provides the past history, the medical records, and so on, and it will help to take better decisions in administration as well as in the field of nursing. Coming to the next week learning. The next week learning objective was the role and guidelines for the nursing informatic nurse. I go through the reading resources, and also by using my strength in learning, which is I used to follow the instructions properly. So I not only go to the learning resources, but also go to the websites of CNA and CNI and I came to know further guidelines about it. The nursing informatics leaders required a structured tool for assessment, and there is a requirement for standardized clinical terminologies. As the main role of nursing informatic nurse is to analyze, monitor, and use the data of the patients in order to provide the best quality care. Next, coming to the week for learning objective, which is to go familiar with the main functioning of the computer. Well, technology plays a pivotal role in the nursing informatics. It enables the informatic nurses to work efficiently into the nursing practice area because it is a complex practice area. As nursing informatics is an evolving specialty of nursing, therefore, a basic knowledge regarding the computers is the main function the main functions of the computer, the basic knowledge is required. This is a necessity. Again, here I would like to discuss my past experience also. When I started working as a registered nurse in India, I also encountered certain issues regarding computers as there were facilities present, but again, they were not really advanced. And sometimes I got stuck with the functioning of the computers. But I would like to share something that sometimes I could not get the simple things about computer, I could not download the files of patients of lab reports directly from the lab portal. Instead, I just go there and receive the files of lab reports of the patients directly by hand. So I believe with the understanding of technology, it becomes easier to handle the whole system of technology as well as nursing skills. Thus, the week 4 learning would help the informatic nursing leaders to fill the gap in the knowledge, which will help to improve the clinical reasoning and will upgrade the health delivery system. Hence, with the nursing informatics, the upcoming nursing leaders can deliver the best evidence care only if they excel in computer technology, and which will ultimately leads to the better functioning of the nursing informatics nursing practices in the nursing profession. To conclude, I believe I have acquired the knowledge regarding nursing informatics, health informatics, guidelines, roles, and the main functionings of the computer. But I would like to share something with that. In my opinion, that if I would get a chance to have an interactive session with other classmates and with the professor, then I would get an opportunity to have exchange of ideas with one another, and it will enhance my learning also, and I will got to know more about nursing informatics, and I will learn in a better way. So this was all about my reflection video. Thank you.